Everyone, and thank you for coming this evening. Our presenter for this evening is Sanjeen Taylor, and she will be speaking to us this evening on occupational therapy. For our housekeeping this evening, I want you to remember to have your mics muted for the time being, and you can unmute when you want to ask that question after the session. So I'm going to introduce you now to Ms. Taylor. Ms. Taylor is an occupational therapist for the past 13 years. She practices at the Queen Elizabeth Hospital and Total Therapy Rehab Office. She has an associate degree in rehabilitation therapy technology and holds a bachelor in occupational therapy from the Brunel University in West London. She has a certificate in hand therapy and attends several seminars and workshops hosted by American Hand Foundation. Ms. Taylor practices mainly in planning treatments for disorders or diseases which affect the upper limb. She does ergonomic assessments and practices equipment and prescribes equipment and devices which enable independence in daily activities. These include carpal tunnel syndrome, de Cravings fractures of the wrist and forearm, trigger finger and tennis elbow, to name a few. She also plans interventions for persons after stroke and for children with hand issues. Ms. Taylor loves her job and said she is keen to offer advice on how to manage and maintain one's independence in daily activities. Good evening again, Ms. Taylor, and welcome. Over to you.
Good evening, everyone. Hi. Good night. My name is Sanjeen Taylor. I'm an occupational therapist. Note I said occupational therapist. I am not a physiotherapist. Okay, we're beginning to talk about what is occupational therapy. Occupational therapy is about doing, being, and becoming. My slides are not moving.
If you click on it, it's not moving?
Yeah, it's not moving. Let me try again. Okay, here we go. Okay, occupational therapist is a person who enables someone to engage in their daily activities after an injury or disease affects them from doing so. The occupational therapist is a type of healthcare professional that enables persons to solve problems which may interfere with their ability to engage in their daily activities. We are usually called enablers. We enable people to engage in their daily function. There are 4 specific specialty areas in occupational therapy. There's geriatric, pediatric, mental health, and physical dysfunction. I work in the physical dysfunction area. There are approximately 19 occupational therapists on island who engage in pediatric and mental health and physical dysfunction. We currently have no person in the geriatric area. I am specifically focusing on the hands and the upper extremity today, with a few disorders or diseases that may cause you to be unable to use your hands at any given time. Being unable to use your hands can affect you physically, socially, and mentally. The hands, that's my love. They're used for working, dressing, brushing your teeth, feeding, using a computer, and so much more. And persons only realize how important they are when they are unable to use them. This is one of my favorite quotes. Busy hands achieve more than idle tongues. And the hand is a visible part of the brain. This is called a homunculus. I love this because in this photo, the hands are large. Large, just about as big as the face and the mouth. The homunculus is a cortical representation of the human body based on a neurological map of the brain. It shows the proportions of the human brain dedicated to processing and motor function and sensory function in the brain.
Yeah.
This is I would say a view of the brain in relation to how the homunculus represents the surface area of the brain. The somatosensory cortex, which is on my left, shows that the surface area for the brain takes up from the shoulder to the thumb, almost 3 convolutions in the brain area. A very large surface area is responsible just for the upper extremity. When compared to, let's say, the gum, just a few millimeters or centimeters in diameter, that is the vast amount of surface area that takes up the somatosensory cortex of the brain for the upper extremity. The somatosensory cortex is responsible for feeling, touching, pressure, vibration, knowing where your hand is in space, proprioception, etc. On the right-hand side, you will see the motor cortex. Still a large surface area of that is taken up from the shoulder to the thumb when compared to the other parts of the body. So the hands take up, I would say, a good portion of your cerebral cortex on your brain because it's responsible for doing so much. Okay, we can now look at disorders of the hand. Today I will cover a few, but mainly these are referrals that I would see for persons coming with the cravings, trigger finger, fractures, tendinitis, overuse syndrome. Carpal tunnel syndrome is very, very common. Arthritis, finger amputations from usually people who work with saws and maybe butchers, people who using cutlasses or knives, flexor tendon injuries, tennis elbow, and burns to the hand. First, let me dispel these myths. Epsom salts and hot water are not to be used for every time your hand hurts or you have a lump or is swollen. But this is myth that Barbadians love. They believe that rubbing with Mustarol and Vicks and Iodex is the answer for almost anything that happens. The next myth is using a ball when you have an injury to your wrist or your fingers. It's not always that you should use a ball. Sometimes it causes more injury than benefit. Massaging is not everything that you can massage. It's not everything that you should rub. And candle grease for me is a no-no. I've seen it cause so much infections and cause people to sometimes lose parts of their hand because you don't really know what is made of. Some people have it stored on a shelf for years and months and then go and use it from the time to get a little prick. Causes infection, cause some people to get amputations, causes a whole heap of injury. Okay, we'll look at now carpal tunnel syndrome. Very common in today's society. Please dispel the myth that carpal tunnel syndrome is only found in people who use computers. It can be found in maids. Practically anybody, I think, can have a diagnosis of carpal tunnel syndrome. It is caused when you have swelling or increase in inflammation in your wrist, in your carpal tunnel, and it causes you to have tingling and numbness in the fingers, mainly the thumb, the index finger, and the middle finger, because that's where your median nerve is distributed to. People wake up with a numb feeling in their hand, and they have to shake it to get it out. Pain in the wrist, just like below the palm. And some people tend not to be able to hold items for long periods of time because you actually start to lose the strength of the hand. It is usually caused by a lot of people who have diabetes are diagnosed with carpal tunnel syndrome. Pregnancy, arthritis can cause it. Overuse or using the hand in bad positions can also cause it. There is radiculopathy, is when you have like a pinched nerve, your nerve that is exiting from your spinal cord to go to your hand is being compressed. Or cervical spondylosis is when you have a slight leaning of the bones in your neck that are causing it to compress the nerve that are running from your neck to your hand. That causes the same tingling and numbness in the hand. It is not diagnosed as carpal tunnel syndrome because you have a different compression area. The compression in cervical spondylosis and radiculopathy is in the neck, while for carpal tunnel syndrome, the compression is actually in the wrist, in the carpal tunnel. Treatment for this would be cold packs, nerve glides. Notice I did not say hot water and Epsom salts. Night splints, not the one with the metal in the palm. Those cause more damage than good. Some people then have to resort to getting a corticosteroid injection inside the area to reduce the fluid. And eventually, if none of the above works, then the person has to go to surgery to have the compression of the median nerve before it becomes very, very chronic. Next is the Cravings Synovitis. That is people getting pain at the base of the thumb or painful wrist. It's called washerwoman syndrome or texter's thumb. And you usually experience a lot of pain when you lift heavy objects. Some people tend to treat this by massaging the area that is painful. Because your tendon or your anatomical snuff box is swollen, the sheath or the tunnel that the tendon passes through is swollen, mainly because of arthritis or overuse of the thumb. People tend to put hot water and Epsom salts and massage, which is a no-no for this. The treatment for this is the Finkelstein test. This is a test that allows you to know if you have the cravings. You usually put the thumb across the palm, cover the fingers, and move your wrist towards the ground. If you have excruciating pain, when you do that, that's a positive sign for the cravings. The treatment for this is ice. Usually because there's swelling, you need to reduce the swelling. Ice is used to reduce inflammation that's occurring in the joint. There's a special splint called a thumb spiker that you should usually use, not a short one. Most people usually go to get a short one. It's one that goes at least halfway up the forearm. Failing that, injection again to reduce the swelling or surgery to free the tunnel that is compressed. We now have trigger finger. Very common. See a lot of patients with these where their fingers stick down. Most people, as usual, would begin to rub it, put it in hot water, put candle grease on it, rub it with nutmeg oil, and that is treating the surface when the actual rubbing causes more pain. Causes of trigger finger are people with thyroid problems is usually frequent in them. People with diabetes, very, very frequent. Arthritis in the knuckle area of the palm of the hand causes more inflammation and causes the tendon or the sheath to swell. And overuse, or if you have something like some maids, if you're a maid or could be a chef and you have a knife or an object constantly pressing on the palm of your hand right in your knuckle area, it causes the sheath to get very, very aggravated and swollen. Treatment for this, notice again, it's ice. Absolutely no massaging the area. Massaging produces heat, causes more swelling eventually. A splint that would stop the finger from bending to allow the sheath and the tunnel where it passes, where the sheath, where the tendon passes through to have an ease. Injection, next solution. And if that fails, because I don't usually see the injection working for this, it may work for a few months, reduces the swelling, but then it comes right back again. The person has to go to surgery. Now, these surgeries are not extensive surgeries. They're not put to sleep, and they're done by an orthopedic surgeon. Should be done by an orthopedic surgeon. Next, we have Ulnaris pain. Very common in persons who are using their hand badly during mainly work. is like it can be caused by repetitive strain injury. It can be caused by ligament injury, and sometimes people who had fractures would experience pain on the ulna, which is the side by the little finger, part of the hand, for months. It's usually caused also by ulnar impact syndrome, where the ulna, which is the smaller bone in the hand on the side of the little finger, is now longer than the radius, and it caused all the other 8 bones in the radius to become malaligned. They're not lined up properly, so whenever you move your hand, it can cause pain and cause the bones to rub together. People who use their hands in bad positions on computers, you can notice in this picture where the person have their wrist just resting down on that side of the computer can cause pain, and the person's elbows are not lined up properly, so a lot of load is going through to the wrist. Treatment for this wrist pain: ice. You can use heat sometimes in this one. Splinting. There's specific splints for this. It could be a wrist splint. It depends on what the diagnosis is, because there are tests that can be done by the occupational therapist to decide if it's the carpals that are out of alignment, or if there's other injuries, like maybe a TFC tear or a rupture of the TFC. It depends on what the diagnosis is. You will determine what splint is needed. If a widget is needed, that is a little wrist strap, very powerful, but very slight. You may need to rest, stay home from work, or engage in certain activities to help strengthen the wrist after it's not been in use for a while. The next syndrome would be tennis elbow. This is when you have your lateral epicondyle, which is the side of your elbow that is to your thumb, starts to hurt. It usually shows up when people lift heavy things, like go to the supermarket, lift up the groceries, and you get a shocking pain going up to your elbow. It's caused by a repetitive action of twisting the hand, lifting heavy objects. Some people may bump the elbow. They say they bump their funny bone, and it causes inflammation and tiny tears around the epicondyle. The epicondyle is the end of the elbow. That part of the elbow that goes like in a lump. The muscle that is inserted into there or attached into there become torn and inflamed and very painful. This, I usually see it a lot in women, but I have seen a few men have tennis elbow. The treatment for this, look at it again, ice, no heat, not as yet. There's a tennis elbow band that can be used for it. This is a tennis elbow band. This kind of keep the muscle from the forearm attached or supported from being slid away from the epicondyle. No heavy lifting for sure, and stop the repetitive action that was occurring. There are also exercises that can be done once the inflammation is reduced, and to help strengthen back the wrist, because you need your wrist to be able to extend in order to have good grip strength. So those are some of the exercises that will be prescribed once you started treating the person for tennis elbow. The next one is cubital tunnel syndrome. This is an entrapment of your ulnar nerve in the elbow, right along the funny bone, as they will call it again. Sometimes when you hit that area of your hand and you feel tingling and numbness in your fingers, that's when you actually hit your ulnar nerve. It is sometimes misdiagnosed by persons for carpal tunnel, because you will get tingling and numbness in your fingers, but mainly the ring finger and the little finger. The treatment for cubital tunnel syndrome is to stop the activity that aggravates the condition, such as keeping your elbow bent. Some people sleep with their elbow bent. That's when they get most of the symptoms. You would get, I would fabricate a splint, an elbow splint, or you can buy a foam elbow brace to be worn at night to reduce you moving the elbow or keeping the elbow bent and reduce the irritation, or use an elbow pad to protect it, to protect the surface area from hitting onto objects during your daily activities. The next one is This is a very common one because we tend to be oblivious sometimes to the pain that occurs in the hand because of work. People don't want to take time off from work. They can't afford to take time off from work. The work itself is the stressor that causes the overuse syndrome, a repetitive strain injury. There are occupations that you would usually see persons with this. Mostly people who works in offices. I've seen a lot of bank clerks with this overuse syndrome. People who type a lot, clerical duties, and assembly line. Sewing, those are little fine motor activities, on manual work like bricklaying and carpentry. Wrist overuse injury is very common in the hand and the wrist, and it occurs when a tendon or cord that connects the muscle to the bone becomes inflamed as a result of irritation or stress. There's swelling, tenderness, and sometimes excruciating pain for the person. Symptoms are burning. You feel shooting pain running, going up the hand, mostly. It aches every time you may lift something or lean on it or touch something. Sometimes the hand becomes so weak it starts to tremor, slight trembling. The person becomes clumsy and there's numbness in the fingers where you can't actually feel stuff. If you hold the hand out like off the body, you would find it feels very fatigued and weak, like if you are not able to hold it up. And you have difficulty performing everyday tasks. It takes longer to heal than the previous diagnosis that I mentioned. You must take preventative steps from early, which is usually not the case because most people, it has to get really, really bad for them to seek some sort of medical attention. It usually heals within 6 months because a tendon or ligament that's injured takes longer to heal than an actual bone. Bone takes 6 to 8 weeks unless you're diabetic or you're a smoker, while tendon or ligament takes sometimes up to 6 months. Sometimes you can also develop chronic pain from these injuries because the person kept it so long, the nerves are now in disarray. And you will develop something called chronic pain syndrome where the hand just constantly hurts and there's nothing. You have to go through a whole heap of therapy in order to ease the pain. An ergonomic assessment will usually be done for persons who are working in have bad ergonomic posture, and you have to make sure that the body is aligned correctly. Neck, because all of the nerves for your hand comes from the bones in your neck, your cervical area, comes down through the shoulder. Shoulder has to be aligned properly. The elbow has to be aligned properly. The wrist has to be aligned properly, and fingers. And your feet must be aligned properly in order to ease the pressure from the back, from the spine. All right. Another way of treatment is to reduce the risk of the overuse injury, making changes to the workplace and the workplace practices. You may have to use adjustable furniture that can reduce the risk of you being in bad ergonomic position. You have to change the way that you work. Most people have to, for example, a cashier at a supermarket who's always using the left hand to slide the groceries past the checkpoint, that is a repetitive strain injury. So it would be encouraged to maybe see if the person can now shift and go to another station where she's using the right hand, and then intermix those two work practices as the day goes by. You can vary the task of moving the hands, like I said, or alternated at work, and you can set realistic deadlines instead of trying to overdo and then cause pain and swelling as a result. You can also adjust the furniture to suit the person's body. You can have keyboard operators and typists usually develop these syndromes, and they can have the furniture, chairs, desk, the keyboard, table adjusted so that they're in good posture. Suggestions to reduce overuse syndrome or to help treat it are to adjust the height of the chair until your elbows are level with the keyboard. Use a chair with a lumbar or back support. Keep document holders next to the computer screen at the same viewing distance. Use a footstool to raise the level of your knees slightly higher than your hips. Locate the mouse close to the keyboard and use a mouse pad. And when possible, use regular size computers instead of a smaller laptop. Smaller laptops kind to keep your shoulders really close together. Treatment for this. Sometimes it takes weeks. Ice in the initial stages, heat as it becomes chronic. Lots of rest. The person may have to get splints, taping. They may have to do nerve glides and exercises. And notice I have here no Epsom salts, massaging, or candle grease. Okay, next is arthritis. Osteoarthritis. There's osteoarthritis and rheumatoid arthritis. Osteoarthritis is the most common form of arthritis. This is a degenerative disease, which means it happens. There are I would think several types of arthritis, but this is osteo, which causes the cartilage, or we would say the hard gristle, we would call it the gristle, around the bones to actually wear down over time, causing bones then to rub on bone. It can damage any joint, and it mostly affects the hands, the knees, the hips, and the spine. Rheumatoid arthritis and osteoarthritis sometimes share the same symptoms of stiffness and pain, especially in the fingers and the wrists. While osteoarthritis is a degenerative condition, rheumatoid arthritis is an autoimmune disorder that happens when your body reacts adversely in the joints. The effects on the hands are when the two bones rub together, especially in osteoarthritis and rheumatoid arthritis, when the cartilage breaks down, causes pain, sometimes pain for years before people realize that they are beginning to get deformities in the fingers and the wrist, and stiffness. Sometimes people wake up with stiffness every morning in their hands. It's mainly because they're developing some form of arthritis. It may be acute, but arthritis may be coming because it comes with age and wear and tear. Symptoms of arthritis are pain in the knuckles, especially, and the middle joints of the finger. Pain where the thumb and the wrist is connected on the base of your thumb. Some people may think that it is the Cravings, the washerwoman syndrome, or Texter's thumb, but there's a test that can be done to decipher which it is. But that also causes pain in the same area as the Cravings if you have arthritis in the base of your thumb, right where it joins the wrist. There's stiffness, pain, swelling, redness. The fingers and the wrist becomes weak. Some people have problems moving their fingers or trying to form a fist. You have a crunching sound whenever you move the fingers, and you have trouble gripping and holding objects. This is a hand with osteoarthritis. If you notice, there are like bumps. They're called nodes of Herbadines at the last joint near the fingernail. Those are synonymous with osteoarthritis. If you see little bumps starting to form on the top of your top joint of your finger, you are developing some nodes of Herbadines. Please do not rub them with candle grease. Please do not rub them with Iodex. The more you rub them, the bigger they grow. Rubbing it causes the bone to start to expand as you keep rubbing them. Eventually, they will get bigger and bigger as time goes on, but you will try to reduce the rubbing so as to reduce the fast progression of them becoming bigger and stopping the joint from moving. This is Swanette Deformities. This is synonymous with rheumatoid arthritis, where you have all the fingers tend to start from the knuckle and go towards the little finger, the ulnar side of your hand. You also get deformities where the fingers, the middle joint drops in and the end joint points up and it looks like the neck of a swan. That's why they call them Swanette deformities. Treatment for this, we usually, occupational therapists will prescribe joint protection techniques, energy saving techniques, and should be managed early. I find that when people get pain in their hands and it is osteoarthritis, they usually ignore it until it gets really bad, until they start to see deformities. The earlier treatment starts, the better the prognosis as to how long it would become unmanageable. I thank you very much, and I thank Ms. Cecilia Neblett-Bradford for this opportunity, and I hope we can do it again, and we can try to take better care of our hands. Any questions?
Are there any questions?
Somehow I cannot hear when people are speaking. Can you speak up?
I'll repeat the questions when they come. Are there any questions from the floor? I have some comments that have been made in the chat, Sanjeen. Yes. It says, it's very interesting. I'm happy to have the names of the many problems with the hands and wrists. This is great. One person said, just one chair change fixed my neck problem. So I have Crystal White who says she has 2 questions. Crystal, can you unmute yourself and go right ahead?
Yes, please. Thank you. Good night, everybody.
You're welcome. Good night.
Hey, good night.
Thank you for this presentation, Sanjeen. It was very valuable.
Welcome.
And I am seeking to be an occupational therapist.
I think you have to speak. I can hardly hear you, Crystal.
You can hear me better now?
No.
All right, I can repeat the question. She said that. You can hear me, Sanjeen? I don't understand because.
Can you hear me a lot better now?
No.
It's probably your mic. It's probably your mic because I can hear her clearly.
Oh, okay.
I am not hearing at all.
Something is wrong with your mic.
Yes, I turned up my volume to.
Because we can hear you speaking. So.
Okay, let me see if I can stop. I can stop share and see if I can turn up my volume. I'll go again. Okay, I'm turning my volume up to all now. Okay, Crystal, can you go?
Yes, please. Thank you. You can hear me clearly now?
No. I'm listening though.
I was just saying thank you for the valuable information. One of my questions is, you mentioned using ice in some of the treatments. Wait, let me unplug my head. For me,
you're cutting out. Can you hear me?
Yes, I can hear you very clearly. But I'll go ahead. So you mentioned using ice in some of the treatments, carpal tunnel and the Cravings, for example. So I was just curious if when you use heat, does it increase the inflammation and worsen the diagnosis?
Sometimes. It depends on when you start to use the heat. Inflammation is usually decreased when you use ice. Ice decreases inflammation. If it's like new prognosis, so the main thing to do is try to reduce the inflammation occurring in the area. Ice is better used for that. As it becomes older or chronic, you can actually use hot and cold, but you also need to know how to apply and when to apply.
Okay.
And the ice means an ice pack. And you should always use an ice pack with some sort of protection between the skin and the ice to reduce any burns from the ice. So you use oil or cream or something to put over the area before you apply the ice pack.
Okay, thank you for that. My second question is, when you were, correct me if I'm wrong, but when you were referencing the Cravings, you said it's better to use the longer splint.
Yes.
But from what I've observed, I've seen a lot of people be fitted in shorter splints. So does this cause the recovery time to be slower?
To me, the shorter splints hardly work. Most people, when they have on the shorter splint and you ask them to move the thumb, they can move the thumb. while the longer splints prohibits you from moving the thumb, allowing the tendons to rest. So people have on, and they also have on a shorter splint, and that splint has a strap right over the area that causes even more irritation of the area. There's a specific splint that I like to prescribe for persons who have the cravings, compared to persons who have a thumb injury that are using the injury for the base of the thumb. Use that splint to help with the cravings. Most of the time it doesn't work.
Oh, okay.
So some people usually buy the wrong splint because they say the wrist is hurting, they'll strap the wrist, and henceforth sometimes make it worse.
Okay, got it. Thank you very much.
You're welcome.
Okay, I have Bendine saying thank you very much for, it was very informative. Dennis says great presentation. RT says, can we get a list of these presented today? I will put my email, a list of the presentation. I will put my email address in the message box. You can email me and I send you a copy of the presentation.
Okay.
I have a question from RM. What are some daily exercises that can be done to prevent hand and neck strain?
Daily exercises to prevent it?
Yes.
I would recommend, it's not always exercising, it's how you position your body, how you work, how you do things. Are you overdoing it? It may not be that you need exercises, it may be that you need to be mindful of how you are doing things and how you are positioning your body. Because exercising will strengthen, keep the joints mobile, but also realize that's why I love occupational therapy, because we focus on functioning as your mode of exercise. So I may tell you, I need you to wash your ears every week. I need you, if you have 100 fish to bone, I need you not to stay up and hold a knife for all 100 fish. You may need to do joint protection techniques. You may need to build up the handle of the knife. You need to do 20, rest the fingers, then come back and do another 20, and kind of do a graded approach to your activities. It may not always be exercises that are needed. It may be that you need to work smarter, not harder.
Okay, any other questions? Cecilia Neblett-Brathwaite, you can go ahead with your question.
Hi, good night.
Good night.
Sanjeen, what I want to know is, would there be any techniques to be useful for the university students, especially as they're studying? You know, you see a lot of students.
I am not hearing you. I'm not hearing you.
Can't hear me?
Hardly. No? Speak a little louder.
Could you hear me now?
Yeah, try it.
Any techniques that you can give at any time, probably at a later date, for university students? You know, sometimes you see them sitting down, crouching over.
I think that would
be a great idea to come and do something.
I see a lot of university students with the cravings and carpal tunnel syndrome.
Yes, so that can be something that we can work on in future.
Yes, I am willing.
Okay, thank you.
You're welcome.
Okay. I'm going through the chat as I go along. Let's see, great presentation. Thanks for the presentation. Somebody wants to know when you're going to return to do leg and foot. Somebody wants to know when you will return to do leg and foot.
When I will return to do leg and foot?
Yes.
I mainly do the upper extremity, the hand and the upper quarter of the area that is responsible for the nerves of the hand. I love hand therapy.
Okay, I have a question coming for you. What benefits can we use to convince CEOs of the value of putting a therapist to assess everyone's desk and chair? What benefits?
I didn't hear that.
What benefits can we use to convince the CEO of the value of getting a therapist to assess everyone's desk and chair?
Oh, it would be so important. Usually I would have people come in to ask for ergonomic assessment. At the hospital, sometimes I go on my own free time and I would go and if the person keeps coming back with this same pain and maybe they need an ergonomic assessment, I would usually do it. Some people request it, but most of the time is their workstation and how they are doing things. So I would put a big value to it because it's important.
Okay, let's see. Are there any natural treatments for rheumatoid arthritis? Are there any natural treatments?
No. For me, I would say doing the things that reduces inflammation in the body. You would have to know what is that you are using or eating or drinking. Like I'm a big against Coca-Cola because of the effects of it on the joints and the bones. And I believe in curcumin or turmeric. That's me. This is not occupational therapy. This is Sanjeen. I think that turmeric and curcumin reduces inflammation in the joints. Very helpful. I just did the Finkelstein test and it's painful. The person that said it just did the Finkelstein test, then you have the cravings. You may need to see me.
I have one. The person says, I had a stroke 1 year ago and my shoulder always seems to be out of joint, so to speak.
The thing I found is that some people who have strokes, because that part of the body, I have found this, I think a lot more lately. So I have found a few people who had strokes and they were being treated for shoulder pain, and in actual fact, their scapula or their backbone, their wing as we call it, was out of place because of the weakness associated with that hemiparesis around the limb, the weakness that occurred from the effects of the stroke. And I find that we don't like chiropractors, but sometimes I have to recommend the person may see a chiropractor because their body are out of alignment. So as we say, the neck bone connected to the shoulder bone, everything is connected. And if one is out of alignment, the person may just need an alignment. And I hope that they're using the shoulder, because sometimes if you sit and just keep it still because it's painful, you cause it to get even weaker and tighter and more painful as a result.
Okay. Can you reverse some of the effects of rheumatoid arthritis? Can you reverse some of the effects?
Oh, no, there's no reversing. Not for rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease. It comes from inside. You can slow the process of the effects down by doing certain things like splinting and maintaining good positioning and joint protection techniques, but you cannot do anything to reverse it.
Okay. Simone Mitchell, you have a question. Do you want to go ahead now, please? Simone Mitchell Lloyd.
Yes, sorry. Thank you. Good evening, everyone.
Yes,
2 quick questions. So I take note of, and what you just said about turmeric actually just spurred another question. So let me start with the turmeric. So given the fact that you are a firm believer of turmeric because it helps with reducing inflammation, how often would you recommend that is it drink turmeric in terms of tea form? Is that how you take it?
That is not that I would not prescribe it. I'm not an osteopath, but usually there is a recommendation if you go into the health shop. If you buy it in tablet form, it would tell you how much to take. You would have to get advice from somebody who deals with the herbal aspects of it. Okay. I would usually do a spoonful of turmeric in warm water every morning.
Okay.
That's me. All right. No, I'm not a herbalist, but that's just me.
That's just you. Okay. All right. Thank you. Next question. With respect to, so I work primarily from home since COVID. I note what you said about the use of laptops and recommending that persons use larger screens. But if it is a case whereby you have to be using laptops, and for me, I use multiple at least two on a daily basis. I note with respect to the image with respect to the hand, the wrist being rested at the edge of the table, and that we should avoid that as much as possible. I note also the fact that it's best when the computers are at the same eye level, I think, as you are, than to be down.
They monitor the screen, yes.
Yes. Sometimes, however, it is almost impossible to create the ideal working environment that meets all of that. So what would you recommend as being the most
I would recommend, since you're working from a laptop,
for, if nothing else,
you get a keyboard, a wireless keyboard. You also make sure that you get maybe the keyboard tray, that one that is adjustable, that can pull out to suit the correct level for you. And you can put the laptop on a phone book, so or some sort of book that's high enough so the level comes to your eye level, and you can have the laptop tray, the keyboard tray in front of you to make sure that you have a good ergonomic position when you're typing. I would say using the actual keyboard on a laptop causes, because you have to keep your hand in such a small space area and your shoulders together all the time, it can cause some sort of repetitive strain injury if you continue to do it over time every day. So I would recommend a keyboard tray and a wireless keyboard.
Okay.
To move you away from being on the laptop constantly.
Okay. All right. Thank you for that.